Hey everyone. Today we're going to unpack a skin condition that so many of us deal with, but often just write off as, simple dry skin or really stubborn dandruff. It's called seborrhoeic dermatitis, and in the next few minutes, we're going to break down exactly what it is, what's causing it, and most importantly, how you can manage it.
So, have you ever had one of those flaky scalps that just refuses to quit no matter what shampoo you throw at it? Or maybe you've noticed that persistent kind of greasy rash that likes to pop up around your nose or in between your eyebrows? If any of that is ringing a bell, you are definitely not alone. And there's a really good chance we're talking about this exact thing.
So, what is this stuff exactly? Well, the official term is a chronic inflammatory skin disorder. But let's be real, what does that actually mean for you? It means you get these patches of red, inflamed skin that are covered with greasy, flaky scales. And let's just bust two huge myths right off the bat. First, it is absolutely not contagious. And second, it has nothing, and I mean nothing, to do with being unclean. This is a medical condition, plain and simple. All right, to make sense of all this, here's our game plan for today. We're going to start with the basics of what it is, then we'll dig into the culprits behind all the flaking. After that, we'll cover how to spot the common signs, walk through your management toolkit, and finally, we'll talk about the long-term outlook. Sound good? Let's jump in. Okay, first section. What is really fascinating about seborrhoeic dermatitis is that it loves to show up at two totally different points in life. First, when we're babies, and then it can pop up again anytime after puberty. So it really comes in two main flavors. In infants, pretty much everyone knows it as cradle cap, and it affects a ton of babies, up to 42%. But the great news is it almost always just clears up on its own. Now, in adults, it's what most of us just call dandruff. But here's the key difference. Unlike cradle cap, the adult version is chronic. That means it tends to stick around, having periods where it flares up and then times when it gets better. And listen, while dealing with it can feel super isolating, it is so far from rare. We're talking about 1 to 2% of the entire general population. That's millions and millions of people who are navigating the exact same thing. So if this is you, you are in very good company. Okay, so we know what it is, but why does it happen? Well, there isn't just one single answer. It's more like a team effort. Researchers have figured out it's a combination of a few key players that work together to cause all that inflammation. So let's meet the culprits. Suspects number one is a fungus called Malassezia. Now, here's the thing. This yeast is a totally normal resident on almost everybody's skin. It just hangs out, usually causing no trouble at all. But for people with seborrhoeic dermatitis, the story's a little different. This fungus snacks on the natural oils on our skin, our sebum, and as a byproduct, it creates something called oleic acid. For some of us, that acid is a major irritant, and it triggers inflammation and that super fast skin cell turnover that we see as flakes. But it's not just the fungus, right? Our own bodies play a huge part. Hormones, for instance, are a really big deal. They're what reactivate our oil glands after puberty, which totally explains why the condition often shows up in our teen years. Our immune system is also a key factor. A really sudden, severe case can sometimes be a marker for conditions that affect immunity, like HIV. And there's also this really interesting link to neurological conditions like Parkinson's, possibly because of how our nervous system can influence oil production. And then, of course, you've got the external triggers, the things in our environment that can make everything worse. Stress is probably the number one most common culprit for a flare-up. I think we can all relate to that one. Certain medications can also set it off. And in a very modern twist, research has actually shown that wearing a face mask for a long time can make the condition on your face worse. So we've covered the potential causes, but how do you know if you actually have it? Well, the key is knowing where to look. Seborrhoeic dermatitis loves oily areas, so it has its favorite hangouts, very predictable places where it likes to appear. Here are the most common hotspots. The scalp is number one, obviously. That's where you get the itching and scaling. But you also want to look in the nasolabial folds. Those are the lines that run from your nose down to the corners of your mouth. The glabella, that spot right between your eyebrows, is another classic location. And don't forget behind the ears and right in the center of your chest. And here is a perfect example of what it looks like. This is seborrhoeic dermatitis right in that nasolabial fold. You can see that mild redness, doctors call it erythema, and you can see that characteristic kind of greasy-looking scale. This is just a classic textbook case. And here we go again, this time in the glabella, right between the eyebrows. Notice the exact same pattern. that mild redness, and those telltale scales. See, once you learn to recognize the pattern, you start to see it's all about where it shows up. Okay, so you've spotted the signs. Now what you do? This brings us to the most practical part of our chat, the management toolkit. And the key word here really is management. Because this is a chronic thing, the goal isn't some one-time cure. It's about effective, long-term control of your symptoms. This is the big question, right? And the good news is there are a lot of effective ways to handle it. The right approach for you is always going to be tailored to where it's appearing on your body and, of course, how severe it is. So let's break down the first-line approach. For cradle cap and babies, it's often as simple as using something gentle like olive oil to soften up the scales. For adults with scalp issues, medicated shampoos are the absolute go-to. And for the face and body, doctors will usually start you off with a topical antifungal cream to fight the yeast, or maybe a mild corticosteroid to calm down that inflammation. All right, let's demystify those medicated shampoos a bit. When you look at the back of the bottle, you'll see a few of the same key players over and over. Ingredients like ketoconazole, selenium sulfide, and pyrithian zinc, those are all powerful antifungals. Then you have salicylic acid, which is a keratolytic. That's just a fancy word that means it helps break down and get rid of the scale. And stuff like coal tar is amazing for reducing that really annoying itch. Now, for the face and body, the approach has to be a little more delicate. The skin there is thinner. So doctors will usually prescribe low-potency steroids to avoid side effects like skin thinning. A lot of times, they'll even combine that with an antifungal cream. The most important thing to remember is the goal is always to use the absolute mildest treatment that can get the job done. So, what does this all mean for the long term? You know, living with any chronic condition is a journey, and it's really important to have realistic expectations about what that road looks like. This quote from the research really just says it all. In adults, seborrhoeic dermatitis is probably never going to completely disappear for good. But, and this is the most important part, it responds really well to the right treatment. The whole goal is to find what works for you to keep your symptoms under control and keep those flare-ups to a minimum. And that brings us to one final, pretty hopeful thought. The science on this is always moving forward. Researchers are constantly looking for better, more effective options, from things like plant-based extracts to new topical foams, which leaves us with a really optimistic question. As all these new therapies start to emerge, could managing this super common condition become even simpler in the future? It's a really exciting space to watch. Thanks so much for tuning in.